Hi there, I'm Diane Carbo with Caregiver Relief. Thanks for visiting with us today. Our website is for caregivers. We know that being a caregiver can be so challenging, but we are here to help. Our website is full of useful information that can make your life easier. So if you want to stay up to date with our latest content, be sure to subscribe to our email list. And as a subscriber, you'll get access to exclusive content that isn't available to the public. And don't miss out on all the great resources we have to offer. Subscribe now and benefiting from our expert advice and support. Thanks for watching, and we look forward to supporting you on your caregiving journey. And today I'm going to discuss Alzheimer's disease and the benefits of pets. This is one of my favorite subjects. Pets can be a powerful source of comfort and companionship for individuals with Alzheimer's disease or other related dementias. Animals do not judge, they don't criticize or expect anything in return. They are content to provide unconditional love that is beneficial on so many levels. Studies have shown that pets reduce stress responses and lower blood pressure, along with providing emotional support through their playful nature. From cats to birds to fish tanks to big floppy dogs, explore the ways having an adorable companion around could bring joyfulness into your life when dealing with developing Alzheimer's disease. Pets as emotional support animals is becoming very popular as we are learning all the positive effects that animal companionship can provide in a clinical setting, especially those from Alzheimer's disease. By forming an emotional bond and providing comfort during challenging moments, pets bring immense improvements to our lives, reducing chronic pain and increasing longevity levels. While the studies are in a clinical setting, I think these same results translate into the home environment. I know for sure they do. Pets improve the quality of life. And for someone with the Alzheimer's dementia, those qualities make them a good companion. The very presence of a pet can reduce the behavioral symptoms of dementia, such as anxiety, agitation, irritability, depression, and loneliness. Most pets by nature are friendly and non-threatening, and this can help a person with Alzheimer's disease be more interactive when sometimes they're not able to do so in a social setting with other adults. I've been in many homes with individuals suffering from Alzheimer's disease, and even in the middle stages of this brain disorder, pets can make a difference. Here are some ways pets benefit individuals with Alzheimer's and related dementias. For many people with Alzheimer's disease, a furry friend can bring long life companionship and happiness. Now, I want to say, I'm going to stop here and say, it doesn't have to be a furry friend. I have people that have their birds and their fish and other creatures, pigs. They're not furry. And they bring such wonderful joy and happiness and companionship for us. But it's important to make sure any animals involved are welcome in the safest possible way. As Alzheimer's disease progresses, you must be aware of how your family members' cognitive decline may affect the interaction with the pet. Of course, there are things to consider, such as who's going to walk the dog, who will feed or groom the pet. Caring for a pet can decrease the progression of the disease. In the early stages, while the thinking skills are still intact, walking and playing with a dog can improve mood and lift the spirits of your loved one with Alzheimer's disease. As the disease progresses, you must consider the person's ability and plan the activities within their mental abilities and capabilities. Caregivers should remember to consider things like allergies or energy levels of both the pet owner and the animal. fall risk increase in the middle to late stages of dementia. Be aware of tripping hazards as your pet and loved one enjoy time together. With all these factors taken into consideration, however, pets could be just what your family needs for emotional support as the disease progresses. Let's talk about mild cognitive impairment. Oh, this topic reminds me of my client, Joe. Joe was just starting to exhibit dementia symptoms and he wanted a dog. His wife was reluctant to have a pet as they had planned to do some really extensive traveling during retirement. His wife reluctantly gave in to Joe's demands and she agreed to a puppy that he fell in love with. It was at that time Joe was experiencing the initial symptoms of mild cognitive impairment. This is a condition that is a normal aging process. Older people, as we age, start to have slower processing of information. We also have a slower ability to retrieve information. Oh, we have all the so senior moments where we forget what we were saying or having word finding problems at a time. Being diagnosed with mild cognitive impairment does not necessarily mean that you will develop Alzheimer's disease. Individuals that have mild cognitive impairment, or MCI, are still able to perform daily tasks without any support. However, there are individuals that will have an increased risk to develop Alzheimer's. If you have a history of familial Alzheimer's disease or a family history of Alzheimer's, this is an increased risk for developing this devastating and progressive condition. I want to explain a little bit about brain function in Alzheimer's disease. Alzheimer's affects the cerebral cortex region of the brain and slowly destroys memory. It is the outermost layer of your brain, and it's the most complex area. It's where all the magic in our brain happens. It's the wrinkled gray matter, the exterior that hides an incredible complexity of at work, from memory to problem solving skills and emotions. Our brain is a powerhouse for many essential functions that keep our brain functioning at its optimal level. During Alzheimer's disease, tau proteins and amyloid plaques build up in the brain, developing structures called neurofibrillary tangles that cause brain cells to die. This is what causes memory loss and memory problems. Sadly, with Joe, it was a precursor to developing this progressive disease. The puppy was a blessing in disguise to Joe and his wife. The puppy helped Joe continue his healthy lifestyle of walking and eating healthy foods to improve brain function and slow the progression of the disease. Most people do not know that diagnosis to death can be as short as 4 years, but it can be as long as 20 years. Murphy, the puppy, may be able to grow old with Joe. Pets can lift your mood and give you joy. Pets are a powerful source of comfort and companionship that can help break up the loneliness, fear, and confusion in a person's life. Pets are a great way to reestablish meaningful connections with Alzheimer's patients. They offer an approachable, calming presence that can help bridge the gap between those who may feel limited in conversation and unable to engage socially due to their condition's progression. Ultimately, this helps lift feelings of loneliness and isolation for such individuals as they seek out companionship. It's important to understand as Alzheimer's disease progresses, the person suffering is experiencing cognitive decline. As brain cells die, it slowly destroys memory. A person with Alzheimer's disease loses their short term memory first. Later, the long term memory loss occurs in the middle to later stages of Alzheimer's. This is important to know because a person with Alzheimer's related dementias is just living in the present. While we talk about living mindfully, a person with dementia is doing just that. Although every individual experiences the stages of Alzheimer's differently, companionship from our furry friends may provide solace and enjoyment. And having a pet encourages exercise. Having a dog can be an excellent way to stay active, even if you don't have the energy or capacity for more intense exercise. A short walk with your pup is a great form of activity that will provide not only physical benefits, but also emotional ones. Getting outdoors improves your spirit and mental health. Getting 30 minutes a day of moderate activity is recommended as part of a dementia prevention program or to slow the progression of Alzheimer's disease. The good news is even 10-minute increments are just as effective. Physical activity is one important way to slow the progression of the disease. To top it off, maintaining muscle strength and simply throwing around some toys also helps and does the trick. Joe loved to walk. He and Murphy walked several times a day, and they took long walks. In the early stages of the disease, Joe took Murphy to the beach and played ball. As his dementia symptoms started to affect his thinking skills, he stopped going to the beach and instead played ball in the yard. Joe needed direction and cues on what to do, such as pick up the ball, take the ball from Murphy, throw the ball. You could see that Joe enjoyed this interaction, even though he had to be directed what to do. Pets encourage better health and behaviors. Did you know that studies show people that own pets lower the risk of developing heart disease and lowering blood pressure? That they also reduce their risk for developing cardiovascular disease, which prevents vascular dementia. So, owning a pet promotes better health and behaviors. Spending time with loving animals can reduce anxiety and boost happiness. In one study, residents of an Alzheimer's care facility were less agitated when a resident dog was present, and even their eating habits improved. Now, the benefits don't stop there. Research indicates that regularly spending quality time around four-legged friends has the potential to lower blood pressure, slow heart rate, and improve overall well-being. Studies show that having pets has actually had an impact at decreasing negative behavioral symptoms. Pets not only bring joy to their owners' lives, but they can also be a great help in managing the physical and mental burdens that come with Alzheimer's disease and other types of dementia. Studies have shown that animals provide stability for people experiencing dementia by providing us a feeling of comfort when faced with new, strange faces or new memories without expecting anything beyond simple interaction from them. This is why so many patients benefit from having an animal companion. Pets increase social interactions for those having Alzheimer's disease diagnosis. Pets can improve a unique opportunity for those with Alzheimer's to socialize and build meaningful relationships. They make great conversation starters, bridging the gap between strangers while still providing comfort in an unfamiliar environment. Who knows what interaction may develop from simply talking about one's pet? Lord knows I've had lots of conversations with all my pets, and they are the best listeners. Let's go back to Joe. Joe was a very social man prior to his diagnosis and cognitive decline. In the middle stages of Alzheimer's disease, Joe lost his ability to verbally communicate. His vocabulary became very limited. Basically, he was able to say yes and no. He was also a very animated man. His facial expressions always gave you an indication on what he was feeling. So, as the brain cells in the language center of the brain died, his communications became more and more challenging. Murphy the dog was great for Joe. He was known in the community, and the two of them walked everywhere. Neighbors always stopped to talk with Joe throughout his disease process. Socialization is so important to slow memory loss. Every interaction we have takes processing, planning a response, and even filtering our response. As Alzheimer's and related dementias progress, we can still build new neurons, internal support by living a healthy lifestyle, getting physically active, and staying social. And pets can help us do that with ease. Pets are wonderful allies in the fight against loneliness, anxiety, and depression. With their unconditional love, they can bring an instant mood boost, no matter how temporary. A friendly, furry friend is sure to add a dose of joy when it feels like all hope is lost. This is important. Remember, a person with Alzheimer's disease and other related dementias live in the moment. They will respond to the moods and feelings of those around them. That's a really important point for family members to remember. Memory problems can result in the person's ability to respond. The result could be your loved one with Alzheimer's disease responding with frustration, irritability, and even anger. Pets have been found to be a calming presence. Now, here's one. Did you know your pets can improve your appetite? While that's not what I need. But while the presence of a four-legged friend or even one with fins or feathers can provide emotional comfort and companionship with those for Alzheimer's, such friends may also give them much needed nutrition. Studies have revealed that keeping pets around can help increase their nutritional intake, from improved eating habits to even gaining a healthy weight. I want to address a little bit how hunger poses a particular problem for those dealing with Alzheimer's disease, especially in the middle to later stages. This is because communication difficulties, confusion, and depression can lead to changes in eating habits that result in erratic food consumption or an overall decline of appetite. Such extreme circumstances can then exacerbate physical deterioration associated with this condition. Impaired walking ability, coordination, and even swallowing and feeding problems occur. Here's another mini anatomy lesson. The hypothalamus is the hunger center in the brain. As late stage Alzheimer's advances and other symptoms develop, it can make it difficult for your family member with Alzheimer's disease to recognize when the stomach is empty or full. Also, as memory loss increases, Alzheimer's patients may simply forget to eat when they are hungry. In the challenging journey of Alzheimer's, you may find it hard to keep up with the unexpected changes in hunger. It is in the final stages, a lack of appetite and extreme weight loss can lead to many health risks for your loved one. Alzheimer's patients can benefit greatly from the presence of therapy pets. A Purdue University study showed that regular exposure to fish aquariums over an 8-week period resulted in significant increase in nutrition intake, allowing those with Alzheimer's disease in the middle stages to gain weight and lessen the need for dietary supplements. In other words, if you know someone suffering from dementia or Alzheimer's disease, look into getting them a pet, as it could help their quality of life significantly. Now, I want to talk about robotic pets. People suffering from Alzheimer's disease and other related dementias can benefit from having a robotic pet companion. A recent study published by Issues in Mental Health Nursing found that 12 participants improved their moods and increased their attention, language, and registration after engaging with robotic cats 4 times each week for 3 months. By providing comfort during these difficult moments while also preventing loneliness of dementia patients, these robotic pets have shown to reduce depression symptoms as well as improve communication skills between individuals within its environment. Robotic pets have unique benefits. Robotic pets offer a unique alternative to the real thing, with many advantages that traditional living animals don't possess. Nursing homes and other care centers may be more welcoming of these, and I know they are, of these robotic alternatives, as they're easier for people with dementia or mobility issues to take care of them. They don't need to worry about remembering food and water, and they don't have to worry about taking a pet to the vet when they're sick or injured. So if someone in your life has dementia, consider getting a robotic pet for them or speaking with your doctor about the option. I've had many dementia patients in the later stages carry stuffed animals and baby dolls around with them. These were not robotic, and they still gave comfort to the person suffering from Alzheimer's dementia. So, if you are caring for someone affected by Alzheimer's, it's important to be aware of these potential issues so you can best support your loved one as they go through their journey ahead. I'm Diane Carbo with Caregiver Relief.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.